Hi, good afternoon. Welcome to Thursday Reading Live. My name is Vandana PS, one of the reading trainers from Neetu's Academy. So in this video, I'll be dealing with the importance of keywords. Okay, so whether the keywords are important in doing part A as well as in part B. Majority of the students have this concern regarding the keywords. How to underline the keywords, how to identify the keywords. So let's discuss about the keywords today. Before that, let's do a sample question from part B. So for that, I'll give you 2 minutes for the preparation of this question. So here comes the question. Welcome back. So good afternoon once again. Disa, Roshna, Reshma, Jomol, Vaishnavi, Sobi. Good afternoon. Alright, so I'm going to learn the question. How was this question? Okay, I'll read the question. So today, as I already mentioned, we will be discussing about the importance of keywords. Okay, so whether these keywords are important, so what is the significance of the keywords in reading? So the question, what is said about smoking mothers? A very short question. So what are the keywords from the question? So my keywords said smoking mothers. So when you read a question from part B, the first step, read the question. The second step, which is a very important one, that is underlining the keywords. So these keywords will help you to find out your answer. Is that true? Yes. Okay, and let's see how. So said smoking mothers. Then today I'm going to read the paragraph first. Okay, because I just want to know about what is said about smoking mothers in this paragraph. Okay, so this is an extract from a notice which is about pregnancy. Okay, so this is a notice and you guys know about notice which we are reading for the purpose. Okay, but purpose the overall idea of the notice. What is the summary of the notice? So I'm just tracing it towards the question here. What is said about smoking mothers in the notice? Okay, and I'm reading the notice. During pregnancy, tobacco use results in roughly 1,000 infants' death annually and is associated with an increase in the risk of premature birth and intrauterine growth retardation. Smoking during pregnancy causes an estimated 5 to 8% preterm deliveries, then 13 to 19% of term deliveries with a low birth weight, and 23 to 34% cases of sudden infant death syndrome, and 5 to 7% of preterm related infant deaths. Smoking during pregnancy increases the risk of childhood asthma and obesity and infantile colic. Pregnancy appears to motivate women to stop smoking. 55% of women who smoke prior to pregnancy quit smoking by the last 3 months of pregnancy. It is also important to note that of those who quit smoking during pregnancy, 40% relapse within 6 months after delivery. So what is a summary or what is the purpose of this notice? What do you understand from this? Hi Jinsi, good afternoon dear. So yes, what do you understand from this notice about smoking mothers? Smoking mothers in the month's life. In the first line, nothing mentioned about what? The problems or about the smoking mothers. So pregnancy time. During pregnancy, tobacco use results in. And what about the next one? Smoking during pregnancy causes. So here comes the keyword smoking. Okay. Then, as well as from the last para also, there are some relations or there are some connections that can be found in related to the question. So here, and you know that if it is a third category, whether it is a notice, email or memo, the last lines are very important. Last lines are important. So, what is the importance of keywords here? We have keywords marked from the paragraph. So now I'm going to read the options and I'm going to underline the keywords. Then we will do elimination. Okay, so whether these keywords will help you to find out the answer. So option A, smoking during pregnancy abbreviates the risk of other diseases. So my keywords, smoking abbreviates risk. Option B, cease smoking during the last trimester exceeds by half. Cease, then trimester exceeds. And option C, tobacco use contributes to the majority of premature delivery. Tobacco contributes premature. So these are my keywords from these options also. Okay, and it's very important, don't mark more than 3 keywords from an option. Or option in the maximum 3 keywords matram mark kiya, adi kudala venda. Okay? Then, so what about elimination? Namukku engane eliminate cheyam? Already we know the correct answer. Ippa namukku answer ekadesham ariyam. But again we are reading the first one. Smoking during pregnancy abbreviates. So smoking abbreviates risk. Where is it mentioned in this paragraph? Smoking abbreviate cheyana parna enda? Reduce cheya. decrease here. So smoking decreases risk. Anywhere mentioned? So I can eliminate very easily because the keywords help me. Keywords yeah, it's not mentioned anywhere in the para regarding smoking reduces the risk of diseases. So we can say not mentioned. And what about option B? Cease smoking during last trimester exceeds by half. So cease, that means stop. Trimester, then exceeds. So these keywords help me to find out the answer, which is, see the last lines, 55% off. Okay, women who smoke prior to pregnancy stop smoking by the last 3 months of pregnancy. See? Okay, so maybe option B, because my keywords are there. And what about option C? Tobacco use contributes to the majority of premature delivery. Okay, tobacco, yes, I have seen this word here, tobacco, contributes to the majority of premature delivery. Yes, premature is here, preterm delivery. So what about the majority of cases? Majority in the parayumbol but here very clearly mentioned only 5 to 8%, and that's not a majority. So I can say it is contradictory option or opposite option. So through the help of the keywords, my answer is option B. Cease smoking during the last trimester exceeds by half. So that means exactly paraphrased in this line. Okay, I'll mark the line. See, this is the exact line. Clear? Yes. So that's all about option B. Yes, so B, 55% back to smoking, yes. And not the majority, yes, quit smoking. That's keywords. CC and quit smoking. Very good. A lot of correct answers here. Yes, Vaishnavi, Anu, Sobi, Reshma, Jinsi, then Roshna, Jissa, Reshma, we are. Okay, very good, very good. Correct answers, okay. That's all about that. Okay, understood how the keywords are helping us? So definitely in part B, part A, part B and part C, the keywords will help you. Okay, yes. So now we are moving to the next one, which is part A. Okay, so we have a new topic here, which is bronchitis. Okay, bronchitis. Then what about the keywords? I have already part B and part A keywords and importance are check. So what are the importance of keywords here? Okay, not a very tough material, but still an average material. Okay, and not that much an easy material also. Easy tough. It's an average material. Okay, so what about your keywords? Keywords and importance, and before that I'll explain about the keywords of part A. And when you underline keywords from part A in the keywords underline cheyumbam ശ്രദ്ധിക്കാനുണ്ട് നമ്മൾ. Okay, Sobi, yes, most welcome dear. Yes, it is a totally different question, yes. Okay, and do check the previous questions also, entirely different questions I'm taking, okay. All right, so yes, coming back to part A, എന്തായിരുന്നു കീവേഡ്സ് ആണ് അല്ലേ. അപ്പോൾ എങ്ങനെ നമ്മൾ പാർട്ട് എയിൽ കീവേഡ്സ് അണ്ടർലൈൻ ചെയ്യാം? ഏതൊക്കെ കീവേഡ്സ് ആണ്, അല്ലെങ്കിൽ എങ്ങനെ നമുക്ക് മനസ്സിലാവും ദീസ് ആർ ദ കീവേഡ്സ്, ദീസ് ആർ ദ ഇമ്പോർട്ടൻറ്റ് വേർഡ്സ്? Okay, so when you take part A, we have 4 different texts in part A, like text A, text B, text C and text D. So when you read this text, I will say you have to read each and every line. ഓരോ ലൈനും ഇമ്പോർട്ടൻ്റ് ആണ്, ഓരോ ലൈനും നമ്മൾ വായിക്കണം. Okay, so that method is called skimming and scanning. അതൊക്കെ നിങ്ങൾക്ക് അറിയാം. So when you read, when you skim, when you fast read, you should underline the keywords. That's called scanning. Okay, so what is scanning? എങ്ങനെ സ്കാൻ ചെയ്യാം, അല്ലെങ്കിൽ എന്തൊക്കെയാണ് ഇമ്പോർട്ടൻറ്റ് വേർഡ്സ്? ഓക്കെ, സോ ലെറ്റ് മീ നോ ഇൻ ദ കമൻറ്റ് ബോക്സ്. ഐ വുഡ് നോട്ട് സേ ദാറ്റ് ഓരോ ടെക്സ്റ്റിൽ നിന്നും എനിക്ക് കീവേഡ്സ് വേണം എന്നല്ല ഞാൻ പറയുന്നത്. ഫ്രം ദ ഹോൾ ടെക്സ്റ്റ്, ഫ്രം ഹോൾ പാർട്ട് എ, വാട്ട് ആർ ദ കീവേഡ്സ് ഒന്ന് പറയാമോ? ഐ വിൽ വെയിറ്റ് എ ഫ്യൂ സെക്കൻഡ്സ്. Okay, ഒരുപാട് repetitions ഉണ്ട്. I know that, you guys know that. A lot of repetitions are there. For example, the name of the disease condition itself, we have a lot of repetitions. So repetition അല്ലാതെ നിങ്ങൾക്ക് ഇമ്പോർട്ടൻ്റ് ആണെന്ന് തോന്നിയ വേർഡ്സ് ഒന്ന് കമൻറ്റ് ചെയ്യാം. What are the important words from text A, text B, text C and text D? Yes. Let me know in the comment box. What are the important words from each of the text? Or overall idea enki kitta madi, because I just want to know that whether you guys are able to underline the keywords. What are the keywords? Okay, so keywords nu parayumbom, these keywords are related to, certain kind of, I'll explain that 13 keyword strategy, it would be better for you. So the first one, according to OET reading, when you read part A, the first and foremost thing is that you can underline the heading. Okay, so you can underline all the heading. So in part text A, there is no heading, but in text B, text C, yes, there are headings. Okay, courses, treatment. So likewise, we have headings in text B and text C. And second one, subtitles and subheadings. So there is no subtitles. Then third one, you can mark all the numbers. എത്രയൊക്കെ നമ്പേഴ്സ് മെൻഷൻഡ് ആണോ പെട്ടെന്ന് നമുക്ക് പറ്റുന്ന ഒരു മിസ്റ്റേക്ക് എന്ന് പറഞ്ഞാൽ വെൻ യു റീഡ് ദ ടെക്സ്റ്റ് യു വിൽ നോട്ട് ബി ഏബിൾ ടു ഐഡൻറ്റിഫൈ ദ നമ്പർ ഇൻ വേർഡ്സ്. അതായത് ഇപ്പം 3 എന്ന് പറയുന്ന നമ്പർ മേ ബി ഇഫ് ഇറ്റ് ഇസ് ഇൻ വേർഡ് നമ്മൾ പെട്ടെന്ന് ശ്രദ്ധിക്കില്ല. ഓക്കെ, സോ ഓൾവേസ് മാർക്ക് ഓൾ ദ നമ്പേഴ്സ്. അതിപ്പോൾ വേർഡ്സ് ആണെങ്കിലും ഫിഗേഴ്സ് ആണെങ്കിലും യു ഷുഡ് അണ്ടർലൈൻ. Okay, and then all the signs and symbols. Okay, from greater than, less than, equal to, percentage. So likewise, any symbols mentioned, so mark all the signs and symbols. Then comes the name. That is the most important thing, because there will be a lot of questions from names, regarding names. Okay, ഒരു disease condition പേരാവാം, ഒരു procedure പേരാവാം, അതല്ല ഒരു മെത്തേഡിൻ്റെ പേരാവാം, name of a country, name of a person. So whatever names they have mentioned, mark all the names. Okay, which is very important. And abbreviations. ഇപ്പോൾ എനിക്ക് തോന്നുന്നു ഇതിനകത്ത് in part this material there are not that much abbreviations, but പക്ഷേ in text B there are some abbreviations mentioned in the bracket. Other than that, not that much abbreviations mentioned. Yeah, അത്രയും abbreviations ഒന്നും ഇല്ല. Then next one, all the brackets. Definitely they will ask you questions from brackets. Sure ആണ്. Okay, and the words that is in italicized or bold letters. ഇപ്പോൾ ഇവിടെ ബോൾഡിൽ കൊടുത്തിട്ടുണ്ട് courses. Okay, as well as diagnosis. കണ്ടോ, these are in bold words, letters. Okay, italicized ആയിട്ട് ഒന്നുമില്ല. Yeah, nothing in italicized letters or words. Then the words that indicate time. സമയം റിലേറ്റ് ചെയ്ത് നിൽക്കുന്ന കുറച്ച് വേർഡ്സ് ഉണ്ടാവും. സോ ബിക്കോസ് ഇപ്പം നിങ്ങൾ ചോദിക്കുക എന്തിനാണ് ഈ സമയം കാണിക്കുന്ന വേർഡ്സ് അണ്ടർലൈൻ ചെയ്യുന്നത്? വൈ? എനി ഐഡിയ? എന്തിനാണ് നമ്മൾ വി ആർ അണ്ടർലൈനിങ് വേർഡ്സ് ദറ്റ് ഇൻഡിക്കേറ്റ് ടൈം? ബിക്കോസ് ദോസ് വേർഡ്സ് വിൽ ഹെൽപ്പ് യു ടു ആൻസർ ദ ഷോർട്ട് ആൻസർ ക്വസ്റ്റ്യൻസ്. ഓക്കെ, ഇപ്പോൾ ഈ ഷോർട്ട് ആൻസേഴ്സ് നിങ്ങൾ ചെയ്യുമ്പോൾ ഡെഫിനറ്റ്ലി ദർ വിൽ ബി എ ലോട്ട് ഓഫ് ക്വസ്റ്റ്യൻസ് റിഗാർഡിംഗ് ടൈം. ഓക്കെ, വെൻ ഇറ്റ് ഈസ് ഇൻട്രൊഡ്യൂസ്ഡ്, അതെപ്പോൾ കണ്ടുപിടിച്ചു? ഓക്കെ, വെൻ they have identified or when they introduced something in relation to the disease condition. അപ്പോൾ അങ്ങനെ there will be questions like, starting with the word when വെച്ച് സ്റ്റാർട്ട് ചെയ്യുന്ന ക്വസ്റ്റ്യൻസ് ഉണ്ടാവും. Then the words can be related with experiment. അതുപോലെ തന്നെ ഐഡൻറ്റിഫിക്കേഷൻ ബേസ് ചെയ്ത ക്വസ്റ്റ്യൻസ് കാണും അല്ലേ? when it is identified, അല്ലെങ്കിൽ why it is introduced, what is the observation strategy, okay, what is a clinical observation there. So അതുപോലെ you can underline all the words that can be connected with experiments. Okay, ഇപ്പോൾ ഒബ്സർവേഷൻ എന്ന് പറയുന്ന ഒരു എക്സ്പെരിമെൻറ്റ് റിലേറ്റഡ് വേർഡാണ് എക്സ്പെരിമെൻറ്റ്. ദെൻ ഡയഗ്നോസിസ്, ഐഡൻറ്റിഫിക്കേഷൻ, അസർട്ടൈൻ, ഓക്കെ, പ്രൊസീജിയർ, മെത്തേഡ്. ഓക്കെ, then the next one, you can mark all the words that can be associated with a research topic. Okay, കാരണം ഇപ്പോൾ നിങ്ങൾ വായിക്കുമ്പോൾ മനസ്സിലാവും ടെക്സ്റ്റ് എ, ടെക്സ്റ്റ് ബി, ടെക്സ്റ്റ് സി, majority research words will be in text D. ഒരുപാട് വേർഡ്സ് ടെക്സ്റ്റ് ഡിയിൽ കാണും that can be related with research. Okay, and the next one is research related words ഏതൊക്കെയാണ്? study, okay, outcome, output, result, പിന്നെന്താ group, aspect, okay, researcher. So likewise population, അങ്ങനെ ഒരുപാട് വേർഡ്സ് ഉണ്ട്. Then the second last one is the first and last line of each and every paragraph. Okay, very clear, and it's obvious that definitely അവർ ചോദിക്കും ഫസ്റ്റ് ആൻഡ് ലാസ്റ്റ് ലൈനിൽ നിന്ന് ഒരുപാട് ക്വസ്റ്റ്യൻസ് ഉണ്ടാവും. Okay, so Very carefully read the first and last line of each and every paragraph. And the final point is all the bullet points. Okay, എന്തൊക്കെ bullet points കൊടുത്തിട്ടുണ്ടോ, read and very carefully read all the bullet points. Okay, അത്രയേ ഉള്ളൂ. So this is all about keyword strategy. Okay, keywords എന്താണെന്നല്ല ഞാൻ പറഞ്ഞേ, what are the keyword strategies. Okay. So now let me read your answers. I mean your keywords. ഞാൻ നോക്കട്ടെ നിങ്ങളുടെ keywords. Okay. Yes, Reshma, headline, subheading, disease, conditions, type of, yes, the condition. Then, okay, type of bronchitis. Okay, Nazia, hi dear, good afternoon. Yes, numbers. Okay. All right. Okay. So a lot of keywords, yes. Very good. Okay. So these are the keywords which you can mark accordingly. So now we are going to do the first question. When you read and when you are underlining keywords from all these texts, same like we can underline keywords from the questions also. Question എന്നും നമുക്ക് keywords underline ചെയ്യേണ്ടത് important ആണ്. എന്തിനാണ്? Okay. So these keywords from the text as well as the keywords from the questions will help you to find out the answer very correctly. Okay. പെട്ടെന്ന് നമുക്ക് keywords വെച്ചിട്ടായിരിക്കും question കണ്ടുപിടിക്കാൻ പറ്റുക. I mean answer കണ്ടുപിടിക്കാൻ പറ്റുക. So the keywords will help you to find out your answers. First one, inceptive factors accountable for the genesis of the condition. Okay, inceptive factors accountable for the genesis of bronchitis. So my keywords, inceptive, factors, then genesis. Accountable നമുക്ക് അറിയാം, which is reasonable, responsible ആണ്, അല്ലെങ്കിൽ answerable ആണ്. Okay, so what about these type of words? അപ്പോൾ ഇവിടെ synonyms ഉണ്ട് plus keywords. Okay, so what are the synonyms? Inceptive എന്താ? Initial. Okay, inception which means initial. Factors responsible for the genesis. Genesis and what is genesis which means? That means what can I say? Onset. Okay, starting off the disease condition. Let me know your answer please in the comment box. നിങ്ങളുടെ ആൻസർ എന്താ for the first question? ഈ keywords help ചെയ്തോ? Inceptive, factors, accountable, genesis. Okay. So let me please know your answer in the comment box. Answer കിട്ടിയോ? Okay, Sunu. Very good, dear. Anyone else with the correct answer? Yes, Roshna. Shiji? Yes. Okay, Nasia. Very good. Answer is from text B. Okay, so my next question, why text B? Why text B? Because the keywords inceptive, factors, onset, genesis. Okay, and I know that my keywords are here in text B. Okay, so what are the initial factors? Initial factors that can be connected with causes. Okay, initial factors, or else you can say causes. So the rest of the things, it's all about what are the factors, what are the causes of the disease. And see this line, initial damage, initial specific causes. So that means answer is from B. Clear? Very good, Jessa. Causes ആണ്. Okay. Okay, Akku, Sulega, Anu, Jinsi, Ponni, yes, Jessa, Reshma, VR, Caroline. Okay, dear, yes, Anne Maria, Vaishnavi. It is from B. Second question. The multitude of which sample is done to implement genetic testing. So my keywords, multitude, okay, then sample, implement. Yes, so these are my keywords. So what do you mean by this multitude? എന്താ ഇവിടെ multitude ന്റെ meaning? What is the meaning of the word multitude here? Or can you tell me what is a synonym for the multitude in from the paragraph? എന്താണ് ആ synonym? Multitude ന് പകരം എന്താ? Sample, implement. Okay, And your answer is correct, very good, which is from text C. Okay, which is from text C. And text C is all about diagnosis, and genetic testing is mentioned in text C. A provider may take samples of your blood or other body fluids to test for the disease. So multitude, which means what? Different types of. ഇവിടെ എടുക്കുന്ന എന്തൊക്കെയാണ് samples? Blood or blood body fluid. Okay, so that means answer is from C. So multitude, sample, implement. Implement here, which means which will help you to. Okay, അല്ലെങ്കിൽ use എന്നുള്ള meaning ആണ്. So that is text C. Okay, so how many correct answers? Sunu, Reshma, Akku, Shiji, Jissa, Anne-Maria, Nazia. Okay, Roshna, Jissa. Yes, excellent. Okay, very good. Third one, classifications of the condition. So my keywords, only one keyword which I'm underlining, classifications. Kinds, types. Okay, so what are the types? Where they've mentioned about the classification types. എവിടെയാണ് ഈ ക്ലാസിഫിക്കേഷൻസ് മെൻഷൻ ചെയ്തേക്കുന്നത്? ടൈപ്സ്. ബ്രോങ്കിയറ്റൈറ്റിസിൻ്റെ ക്ലാസിഫിക്കേഷൻ അല്ലെങ്കിൽ ടൈപ്സ് എവിടെയാണ് മെൻഷൻ ചെയ്തേക്കുന്നത്? വേർ ദേ മെൻഷൻ അബൌട്ട് ദ ടൈപ്സ് ഓഫ് ദ കണ്ടീഷൻ. ഓക്കെ, ആൻഡ് ദ ടൈപ്സ് മെൻഷൻഡ് ഇൻ text A. See the second paragraph. Healthcare providers categorize bronchitis based on these conditions. So ഏതൊക്കെ ടൈപ്സ് ആണ്? Cylindrical, okay, and cystic. So 2 types. Answer is from text A. Clear? That's from text A. And fourth one, the principal determination behind the supervision of bronchitis. Okay, so principal, determination, supervision. Yes, principal, which means you know that it is very important, important, main. Identification behind the supervision of bronchitis. Yes, so what about fourth one? Okay, supervision എന്ന് പറയുമ്പോൾ നമുക്ക് ഇവിടെ അതിൻ്റെ പർപ്പസ് ആയിട്ട് എടുക്കാം, അല്ലെങ്കിൽ what is the aim? Okay, or you can say aim ആണ്. Okay, not aim. Yes, aims ആണ്. Okay, so what about fourth one? Fourth one in the answer കിട്ടിയോ? Principal, determination behind the supervision of bronchitis. And my answer is from, okay, എവിടെയാണ്? It's from text D. See, under the title treatment, see the first point, aims at. Okay, so what is the purpose of the treatment? It is aiming to different things. So that is from text D. Okay, fifth one, why is it strenuous to appraise the exact number of cases of bronchitis? So my keywords, strenuous, appraise, and number. So strenuous namukku ariyam, very difficult. Okay, so why is it difficult? Okay, to identify, അല്ലെങ്കിൽ to calculate, to gauge, measure the exact number of cases of bronchitis. അത് എവിടെ പറയുന്നത്? It is difficult to calculate. Any idea? Where is it mentioned? It is difficult to identify, അല്ലെങ്കിൽ it is difficult to, yes, identify the actual number. It's from text A. See the last line. The actual number might be higher since you can have bronchitis without having any symptoms. So why? Because there will be no symptoms. Asymptomatic ആണ്. അപ്പോൾ അതുകൊണ്ട് it will be very difficult to identify the exact number of the disease condition. Okay? So answer is from text A. It's not a very direct answer. I can say very tricky and indirect answer. And sixth one, instrument named bronchoscope to ascertain and obliterate anything blocking our airways. So instrument, bronchoscope, ascertain. Yeah, so these are my keywords from sixth question. Oru lengthy question aanu, but still very familiar keywords, alle? Instrument. So my answer is definitely yes. I'm searching for the instrument here. Okay, see the instrument, where is it mentioned? Bronchoscopy. Okay, so they will use a bronchoscope. That is the instrument they have mentioned. It is a long flexible tube with a light and camera at the end to find and remove anything blocking your airways and get samples. So blocking in pagaran endu koduttirikkunne obliterate. Okay, no, blocking alla, sorry, remove aanu. Okay, it's not blocking, remove in pagarana. So instead of remove, the synonym mentioned is obliterate. Okay, so answer is from text C. So yes, so my answer is from text C. And the last one, seventh one, medications that would be beneficial to cease exacerbation. So my keywords, medications, cease exacerbation. Cease ennu panna endha? Stop cheya. Okay, so severity stop ചെയ്യാൻ വേണ്ടിയിട്ട് നമ്മൾ യൂസ് ചെയ്യുന്ന മെഡിക്കേഷൻസ് എവിടെയാണ് കൊടുത്തിരിക്കുന്നത്? So the medications mentioned, yes, of course, in the treatment, so which comes under here, a lot of medical terms, medicines mentioned here. So answer is from, again, text D. So these are the answers, B, C, A, D, A, C, D. Okay, any doubts? Any of the question? Anyone with 7 out of 7? No. Okay. So now 8 to 14. Eighth one. The inadequacy of which enzyme can also act as the causative factor of bronchiolitis. Okay. So my keywords, inadequacy, enzyme, causative. Okay, Reshma, you got 7 out of 7. Excellent here, okay? Good enough, yes. Okay. So, what about 8th one? Do you know the answer? 8th question. Inadequacy of which enzyme? So, always answer to the question. You have a question and the which enzyme? Okay. So, which enzyme? Our enzyme is the So, which enzyme? Let me know your answer. Which enzyme? Which enzyme is mentioned? It is a causative factor that comes under the causes. Yeah. So I am stick with text B, causes aanu. And which enzyme is mentioned here? Which enzyme is mentioned? Okay, so that answer is from the last line, alpha-1 antitrypsin. Okay, so that is the causative factor, which is an enzyme. Again, enzyme it's not mentioned anywhere in this text, but still it's an indirect question. This is a direct question. With our knowledge, we should identify it is alpha-1 antitrypsin. Okay, so answer is from text B, the last one. Then, next one, 9th one, the kind of bronchiolitis that causes the mildest defect to the airway. So, kind, then mildest, and defects. So these are my keywords. Okay, but kinds, we have 2 kinds, which was in text A. Cylindrical and cystic. Which is connected to what was that? Airway. Defect in the airway. Yes. Okay, very good, Vaishnavi. It is cylindrical bronchiolitis is the most common and least serious form of bronchiolitis. And it can affect your airways. So, answer is cylindrical bronchiolitis. Okay, very good. That's from text A. Okay, Anu, Reshma, Caroline, Shiji, Jissa, Vaishnavi. Correct answer. Okay, and what about 10th one? What gets lowered through the intake of transplant medication that can increase risk of infection and the condition? Okay, what gets lower? But the question is, what gets lower? What lower is from the intake of transplant medication. Anything is getting lower here? What is getting lower? And then we lower decreasing. Something is lowering, reducing. So what is reducing? Any idea? What is reducing here? Any idea, Reshma, Anu, Caroline, Shiji, Jissa, Vaishnavi, Sunu? What is lowering here regarding transplant medications? Okay, Sulega, 9th one is cylindrical. Yes, dear, correct one. So what about 10th question? 10th one. Very good, Reshma. It is immunity. Okay, see, transplant medication നമ്മുടെ keyword ആണ്. Decrease immunity. So what is decreasing here? Immunity is decreasing. Okay, and what is increasing? Increasing the risk of infection. Okay, so decreasing ആണ് നമ്മളോട് ചോദിച്ചിരിക്കുന്നത്. That means answer is immunity. That is the correct answer. Okay, very good, Reshma. And 11th one, the usual test conducted to assess the measure of lung function is called what? So what is it called? Usual tests. What tests? In the test ആണ് conducted to assess lung function. A very easy and direct one. അല്ലേ? ഏത് ടെസ്റ്റാണ്? That is lung function test. A provider uses lung function test to determine how well your lungs are working. Very good, Reshma. It's lung function test. Yes, Caroline, it is lung function test. Okay, Sulega. 10th one, immunity. Excellent, dear. Very good. Okay, Nasia, it's lung function test. Very good, dear. Okay, and what about 12th one? What outcome can be expected when scaring and in your lungs pulls your airways out of shape? Okay, outcome. So what is the question here? What is the outcome? Okay, what is the result that you can expect when scaring in your lungs pulls your airways out of shape? Okay, so these are my keywords. What, outcome, shape. Okay, I know lung function test. Very good, dear. So 12th one. What about 12th one? What is the result? എന്താ നമുക്ക് കിട്ടുന്ന ഔട്ട്പുട്ട് എന്താ? ഔട്ട്കം എന്താ? Okay, yes. So outcome or outcome which is related to diagnosis. നമ്മൾ ഐഡൻറ്റിഫിക്കേഷൻ നടത്തുമ്പോഴാണല്ലോ we are getting അല്ലെങ്കിൽ we will get a kind of outcome. അപ്പോൾ എന്ത് ഔട്ട്കം അവിടെ കിട്ടുക? What is the outcome here? It's actually, yes, C or no? Is it from text to C? Outcome? No, അതാണ് ഞാൻ പറഞ്ഞത്. It is important to underline the keywords. അല്ലേ? So keywords വെച്ച് നോക്കുമ്പം നമുക്ക് എവിടെ നിന്ന് ആൻസർ കിട്ടുക? Question number 12. Outcome expected and lungs pull your airways out of shape. So what is the correct answer? Is it from text to C? Identification vadiyanno? No. So the keywords it's from text A. Alle? That's from text A. And where is it mentioned? Okay, see, it's from here. Traction bronchitis happens when scaring in your lungs. Kanda. So these are the keywords. Scaring in your lungs pulls your airways out of shape. So what is the outcome here? That is traction. Okay, so answer is actually from text A, and answer is traction bronchitis. Okay, so answer is traction bronchitis. Yes. Okay. All right. Yes, Akku. Jissa, correct answer. Then 13th one, the confirmation of which condition is generally done through the procedure called sweat tests. So my keyword is condition and procedure sweat tests. So these are my keywords. ഏത് കണ്ടീഷനാണ്? വിച്ച് കണ്ടീഷൻ? അപ്പോൾ അതാണ് ക്വസ്റ്റ്യൻ. ഏത് കണ്ടീഷനാണ്? വിച്ച് കണ്ടീഷൻ? ഓക്കെ, സോ കണ്ടീഷൻ ആൻഡ് ദ കീവേഡ്സ് മെൻഷൻഡ് ഇറ്റ്സ് ഫ്രം ടെക്സ്റ്റ് ബി. ഓക്കെ, യെസ്. So what is the correct answer here? It's from text B. What is the condition? Some of the specific causes of initial damage which starts the cycle of the condition include, and what is the condition? Answer is cystic fibrosis. Okay, cystic fibrosis from text C. Which condition is generally done through procedure called sweat tests. Okay, this is our transaction. Yeah, previous one. And what about 14th one? How long should one be treated with parenteral antibiotics to manage acute exacerbation? So how long? That means duration. Okay, duration. അപ്പോൾ ഒന്നില്ലെങ്കിൽ നമുക്ക് അറിയേണ്ടത് ടൈമാണ്, ഓർ യു ഷുഡ് നോ അബൌട്ട് ദ ഇയർ ഓർ മന്ത്സ്. ഓക്കെ, അല്ലെങ്കിൽ എന്താ weeks or days. ഇങ്ങനെയാണ് വരിക. സോ ഇതിൽ ഏതാണ്? ടൈം ആണോ, ഇയർ ആണോ, മന്ത് ആണോ, വീക്ക് ആണോ, ഡേയ്സ് ആണോ? യെസ്, വെരി ഗുഡ്. ഇറ്റ് ഈസ് 2 to 4 weeks. Okay, answer is 2 to 4 week, and which is from text D. Yeah, see, 2 to 4 week of parenteral antibiotics. So answer is 2 to 4 week. Yes. Okay, Reshma. Yes, Jissa, Akku, Nazia, Aisha. It's not twice daily, dear. It is duration, so that means 2 to 4 weeks. Okay. Okay. Yes, Kamalesh. It is 2 to 4 weeks. Okay, Aisha. Very good. Yes. Yes. Okay, Reshma. Yeah, it's 2 to 4 weeks. So now we are jumping to 15 to 20, which is fill in the blanks. Okay, so answer in a word or a short phrase. So 15th one, magnification of dash in the mucus causes more inflammation and damage to your lungs following the damage or airways. So magnification of what? Any idea? Magnification of what can or what in the mucus causes more inflammation and damage your lungs. So what is it? Okay, and my keyword, or I can say the synonym which is mentioned in text A. Okay, see, bacteria then grows in the mucus, okay, causing more inflammation and damage to your lungs. See the keywords. Okay, so mucus, then inflammation, damage. So answer is bacteria. So magnification of what? Growth of what? Bacteria. അപ്പോൾ മാഗ്നിഫിക്കേഷന് പകരം ഗ്രോത്ത് ആണ്. ഓക്കെ, സോ ആൻസർ ഇസ് ബാക്ടീരിയ ഫ്രം ടെക്സ്റ്റ് എ. 16th one, in bronchoscopy the provider will find and remove anything blocking your dash and get samples of mucus or pus from your lungs or testing. So what about 16th one? What about 16th one in bronchoscopy? So bronchoscopy, which means it's mentioned in evideya text C alle. Very good. Yes, answer is airway. Okay, airway. So blocking your airway. So bronchoscopy, in some cases a provider may use a procedure to look more closely at your airways. Okay, so that's answer is airway from text C. Yes, airway. Then next one, 17th one, about 350,000 to 5 lakh people in the US have bronchitis. That includes 1 person out of 150 people who are dash. Who are what? Endana? Who are what? Yes. Okay, Nazia, Kamlesh, yes, Caroline, Jissa, Aisha, Reshma, Anmol, Akku, Vaishnavi, it is airway. Very good. Okay, Reshma, it's 75 and older. Yes, 75 and older from here. Kanda, a same line. Okay, exactly a same direct answer, 75 and older. That is the correct answer. And next one, in a dash, they will make your arm or leg sweat, collect sample and test it for signs of cystic fibrosis. Okay, again 18th one, which is from text C. Yes, so what is the correct answer here? Sweat chloride test. Okay, Aisha, 75 and above. Okay dear, actually 75 and above nalla, ivide nammal 75 and older എന്നാണ് ട്ടോ. So you can write, instead of above you can write older. Okay, so whatever mentioned there you can write that. It will be better. Okay, so answer is എന്തായിരുന്നു? Yes, sweat chloride test. Okay, a lot of correct answers. Yes, Jissa, Vaishnavi, Reshma, Anu, yes, sweat chloride test. 19th one, dash encompasses inhaled hypertonic saline or mannitol, also improves quality of life in adults with bronchitis. So what encompasses? Encompass എന്ന് പറഞ്ഞ എന്താ? Incorporate ചെയ്യുക or include ചെയ്യുക. Okay, simply I can say include. Yeah, so what encompasses? Very good. Yes, Vaishnavi, correct answer. Okay, airway hydration. So that's from text D. Answer is from here, airway hydration, inhaled hypertonic saline or mannitol. So those are the keywords, alle. So answer is airway hydration. Okay. Yes, Akku, Jissa, Caroline, Reshma, Anu, and Mall. Okay, Aisha, it's airway hydration. Okay, Nasya, correct answer. And what about the last one? Dash and hypoglycemia are conditions that decrease immunity and increase of infections. Dash and what? Okay, so what and the condition. Okay, so answer is actually from now. From which text? Is it from text D, or text C, or text B, or text A? Okay, answer is from text B. Yes. So this is one of the keyword from the question. And what? So the missing word is HIV. So answer is HIV. Okay, so that is the correct answer. So anyone with 20 out of 20? Yes, Aisha, it's from text B. Okay, dear. Okay, so anyone with 20 out of 20? And yes, tomorrow we'll be gonna deal with a very tough material. Okay, so please do attend the live segment at sharp 2:30 p.m. Okay, so thank you everyone. God bless you all.